everyone. Well, welcome to my webinar. I am Tonya Lahatte. I am a functional medicine provider, and I wanted to share today with you my own personal journey with gut health, as well as some tricks for treating a condition called small intestinal bacterial overgrowth. When I went to functional medicine school with the Institute of Functional Medicine, learning about gut health, we had a moderator at our table, and this moderator was an experienced functional medicine doctor. We were learning to do tongue exams, which is a type of Ayurvedic medicine that you can kind of tell a little bit about your gut health from what's going on with your tongue. And I remember I stuck my tongue out and the moderator goes, "Oh, you've got SIBO." And I'm like, "What's that?" Because we had never, I had not learned in school what SIBO was, as has not a lot of the population of people in the medical community. And I had always had for a long time irregular bowel patterns, a lot of gas and bloating, just discomfort when I ate vegetables. I just assumed that because I ate a lot of vegetables that this was what a tummy felt like and was supposed to feel like, and I didn't realize it was an unhealthy gut. And then once I treated my SIBO, which was over 5 years ago, longer than that actually, then now the way that my tummy behaves, as long as I'm eating good, healthy, whole foods, no matter what it is, I'm completely unaware of my gut. I have no gas, no bloating, no discomfort, and it's actually pretty nice. What exactly is SIBO? So SIBO stands for something called Small Intestinal Bacterial Overgrowth. It occurs when the bacteria grows where they shouldn't be in the small intestine. And this can cause lots of symptoms, including gas and bloating, fatigue, brain fog, rosacea, joint pain. There's two conditions that I've seen in my life can create a plethora of symptoms that sometimes look disconnected and that they shouldn't even be going together, and that is small intestinal bacterial overgrowth, SIBO, being exposed to mycotoxins. So how do you diagnose SIBO? So SIBO is best diagnosed with a breath test. So what you're going to do is the day before you take the breath test, you're going to eat a special food plan, and all of this is listed out in detail in the breath kit. You're going to eat a special low FODMAP food plan. The morning of the test, you will get up fasting and you will drink a lactulose solution. And then at periodic intervals, what you will be doing is you will be measuring gases by blowing in a bag. So I tell my patients, you're going to be blowing in a bag, and this is how we're going to test whether you have SIBO. There are typically two gases that are measured, hydrogen and methane. Diagnosing SIBO, though, can be tricky, and the reason it can be a little bit tricky is because on these tests, what happens is if you've got a lot of dysbiosis also in the large bowel and it's just not confined to the small bowel, a computer reads these tests and it makes a decision based on where it starts and where the curve ends as to whether you have SIBO or don't have SIBO, and it can be misleading. I remember when I first started treating SIBO, I got a test and it looked completely negative, and both the hydrogen and methane numbers were negative. And I looked at the patient and I said, "You definitely don't have SIBO." 2 years later, she's like, "I'm fine as long as I don't eat vegetables." I said, "You've got SIBO and we need to treat your SIBO." So we treated her SIBO despite what her test looked like, and we resolved her complaints, and now she has a normal abdomen or tummy. So how do you treat SIBO? So the best way to treat SIBO is with both a starve and a kill. So you're going to need either an elemental or a low FODMAP food plan, and you're going to need supplements and or antibiotics, or both. Functional medicine specializes in treating SIBO. It's something we learn a lot about in our training, and it's a lot more than just taking antibiotics. It's also about restoring balance. That is with the right diet, healing the gut from the SIBO, and addressing all the gut healing strategies to repair your gut and optimize it back to optimal wellness. Oh my goodness, so we're already at the question and answer session. I guess I went really fast. So I guess now it's your turn. So let's tackle some of these questions you've sent in, and let's see, and some that are coming here live. So what are the best supplements for SIBO? So what I have personally found, there's a lot of supplements that are in the press for SIBO, like oil of oregano or berberine. What works best in treating SIBO is a combination of supplements. You have to mix berberine and oil of oregano, or you have to address biofilm. All of this is listed in my SIBO guide. So if you grab my SIBO guide, you'll have a good understanding for this question. So let's see, how important is the low FODMAP diet? Okay, so one of the things that I tell my patients, you need to be at a minimum at least 90% compliant as the worst case scenario, because you cannot treat SIBO with supplements alone, and you cannot treat SIBO with diet alone. It takes a combination. So can antibiotics be used for SIBO? And if so, please explain how to use them. So there is an antibiotic called Xifaxan that is prescribed often for SIBO. What I see a lot though is that, like I said earlier, antibiotics alone, supplements alone, low FODMAP food plan alone is not that effective, and you usually just end up with recurrence. And so I do use antibiotics when I'm treating SIBO, but I usually use them at the end of a treatment protocol in which I have put someone on a low FODMAP food plan and supplements, because I feel like you get the best results from a low FODMAP food plan and supplements. And there's actually been clinical studies that have compared the both in head-to-head trials, and they have shown that supplements are more effective in treating SIBO. And then if I am going to use antibiotics, I feel like it is appropriate for this patient's treatment, I like to top their treatment plan off with antibiotics. So how do I find the root cause of my SIBO? This is probably the most important question of the day. If you do not address, and thank you for the question, if you do not address the root cause, your SIBO will come back. And so I actually have a free questionnaire in my guide that will help you determine what is your cause of SIBO if you think you have SIBO. So what is the SIBO return rate? Well, when I was training on SIBO with IFM, Dr. Mullins from Johns Hopkins was the gastroenterologist who was in charge of our GI module. And he made a comment. He said, I feel so sorry for SIBO patients, as SIBO can be persistent and reoccurrent. The return rate out in the world is about 65%. That is really high. And I think the reason that is I think that there's such a misunderstanding about SIBO, and it's not properly addressed, and this happens from the providers not staying on it to the end of the treatment protocol. My reoccurrence rate is about 1%, and I tell my patients we're going to hit it long and we're going to hit it hard, because I want to get this over with, and I don't want your SIBO to come back and this to be where you're coming back and coming back and coming back. So is SIBO hard to treat, and why is it so important to address the root cause? Well, like I said earlier, if you don't address the root cause, it's going to come back, and SIBO is very hard to treat. In the beginning, I felt like I had patients that got well with an 8-week food plan and a few little supplements, but I think, and this is my own personal philosophy, I don't know, there's no data on this, but as antibiotic resistance is increasing in society, in our population, I think that is one of the reasons that SIBO is getting harder and harder to treat, because our bugs are becoming more resistant to kill agents, and supplements are natural antibiotics. So what's the most important thing I can know about treating SIBO? How important it is to treat SIBO is what I would say to this question. And the reason I would say that is because, SIBO, your gut is the motherboard of your computer, and if something is awry with the motherboard of your computer, something is going to go awry with your computer. And SIBO is linked to so many conditions that can be life-altering, such as POTS or autoimmune diseases. SIBO causes leaky gut causes autoimmune diseases. And so that's why I think it's important, and the most important thing you need to know about treating SIBO is that you do need to treat the SIBO even if you don't think your case is that bad. The second most important thing that I think I would say is that you have to realize you have to do a starve and a kill at the same time. In other words, that's a low FODMAP food plan and herbal antibiotics, and possibly topped off with antibiotics or medicine antibiotics is probably the most important thing, because you cannot treat it with only one thing alone. So let's see, last question. If my SIBO symptoms are not that bad, why should I treat it? Well, I think I kind of answered this a little bit earlier, that SIBO is linked to lots of bad things, such as POTS, leaky gut, autoimmune disease. And I think of, and this is what I tell my patients, if you've got a gut issue and you don't fix it, that's a little bit like petting a rattlesnake. You don't really know how that's going to turn out. It may be okay, it may not be okay. But since our gut is such an integral part of our health, it is absolutely important that you understand the importance of gut health and that you take it seriously. So I invite everyone who is on this webinar to please download my free guide if you think you have SIBO, and to learn about it, and also share it with a friend or family member if you feel like they're complaining about gut issues. And remember, healing starts with understanding. So if you're ready to take control of your gut health, I want you to, like I said, download the free guide, or you can schedule a free consult with me if you're in the Nashville area.